My name is Sagar Patel. I'm going to be practicing at our Alpharetta, Georgia location for Center for Vein Restoration, and I will be there treating patients with venous insufficiency, venous ulcers, as well as lymphedema. I got my medical degree at the Medical University of Lublin in Lublin, Poland. After I graduated from medical school, I started my residency in family medicine at Union Hospital in Terre Haute, Indiana. There I was experiencing a lot of facets of rural health. It was a rural hospital, so there was a lot that I got to see and do over the course of my training. And that kind of set up a good base of knowledge for me to narrow my expertise into vein care. Initially, I trained in family medicine and I was trained in primary care, kind of trying to see the entire patient. And I saw a lot of patients who had venous insufficiency. And even then, at that time, my knowledge was limited um, about venous insufficiency and lymphedema. And I had a lot of patients on my panel that had, you know, heaviness in their legs, swelling, even ulcers. And even when we saw varicose veins on some of our patients' lower extremities, it was always kind of taught as a cosmetic issue versus a medical issue. And then I decided to kind of spend some more time with physicians out there in Indiana and increase my knowledge about venous insufficiency and how to treat my patients who are in so much pain. So that kind of led me to further my knowledge and find treatment opportunities for my patients. And that's what I'm really excited about in terms of providing vein care, is that, the satisfaction I get from treating our patients and, seeing how much they improve after we do some of our procedures or even conservative management. I was trying to increase my knowledge of venous insufficiency, and I was actually told about a fellowship that was specifically geared towards vein care. And that's how I happened to come upon Center for Vein Restoration. And so I applied to the fellowship, and I had a wonderful experience over the course of a year, learning about venous insufficiency, getting more experience with procedures, and getting very good at them. And so towards the end of my fellowship, I decided to stay on with CVR because it was such a great place. I felt like I could help patients and also further my academic knowledge. I will be treating patients with venous insufficiency, lymphedema, ulcers, but I want to go a little past that. My philosophy is to not only treat those patients who have the signs and symptoms of the disease that I'm trained to treat, but also, there are many other causes for lower extremity swelling and pain and heaviness. And so my philosophy is to not just focus on veins, but to make sure that if I can't provide any comfort to my patients, that at least I can send them in the right direction towards the appropriate physicians or health professionals that can get them the help that they need so the patient can have overall better health. I want to make sure that when my patients come to me, that they know that they'll be in good hands when it comes to venous related health issues. But I also want to be a connection to overall better health. I want to make sure that they are completely taken care of in terms of not just vein related issues, but whatever it may be, arthritis, maybe they have high blood pressure, maybe they haven't seen a primary care physician in a long time. I want to be able to connect my patients to just better health outcomes and overall better healthy lifestyle.